Jamie Domberg and her new bestie.
I love it.
Wonderful.
I love it.
Now, they do say that prevention is better than cure, and this is the case when it comes to immunization. The World Health Organization has recounted how, over the years, vaccines have prevented countless diseases and saved millions of lives all over the world. And as we commemorate International Youth Day today, we take a look at the importance of childhood vaccinations with the medical head of Sanofi Pasteur Vaccines, Dr. Nasiha Soofie, who joins us via video call. Thank you very much for joining us, Dr. Soofie. How are you this morning?
I'm well, thanks, and thank you for this opportunity.
It's a pleasure to have you here with us. We want to start off by asking, how do vaccines work and why are they so important?
So vaccines are actually a medical formulation, and what this formulation contains is actually a dead form or a killed form, or you could say an attenuated form of the actual virus or bacteria that you want to protect the recipient against. So basically, when you inject the vaccine into the body, it fools the body into thinking that it is being attacked by the actual virus or the actual bacteria. And as a result, the body responds by mounting an immune response. It creates millions of antibodies. However, these antibodies are not really used because the virus or the bacteria which you had injected was not the real virus or the bacteria. And so your body is now in a sort of heightened state of awareness. And so what happens is, after the vaccine, if you happen to come across someone who's infected with the real virus or the wild virus, for instance, if you've been vaccinated against influenza and you come across a family member who's now infectious with the actual virus, and that virus is passed on to you, because you have been vaccinated and your body is ready, your antibodies are on standby, when the real virus enters into your body, you are able to neutralize the virus and thereby not fall ill.
Now, there's been a constant debate of late, especially, on whether vaccines are indeed safe, especially for babies and young children.
Yes, so it's very important to note that South Africa has some of the most strict regulations in the country when it comes to bringing in any product, any biological product into the country. And I would be safe to say that in some respects, we're actually a lot more strict than many first world countries. And so before a vaccine is actually brought into the country, you can be sure that it has been tested over decades, spanning hundreds and thousands of individuals, not only in South Africa, but across the globe. And during this time, over the decades that it is being tested, we source data on the safety of the vaccine. Is it tolerable for human consumption? Until we are convinced, then only will a vaccine be introduced into the South African market. This is not to say that there may be some minor side effects or adverse events, as you would expect with any injectable. Maybe some redness at the injection site, some swelling. There may be one or two individuals that may have a severe adverse event, but this is indeed rare.
And between which ages should children be vaccinated?
So it's important to note that vaccination is actually a cradle to grave concept. We make the mistake as a country to assume that vaccination is only for children. But actually, vaccination can start, in fact, even before the cradle. So vaccination is important even for pregnant mothers to protect their fetus, to protect themselves, all the way to the grave. So it is a concept which we need to understand has to occur throughout our lifespan, from pregnancy through to birth. Toddlers require vaccination, adolescents, adults, and the elderly.
Oh, Dr. Soofie, thank you very much for joining us. A really succinct explanation on the topic of vaccines, and it's quite an important one for us, of course, to understand, especially given the times that we are living in right now. But you at home, do make sure that you stay tuned to your Feel Good Breakfast show, as Dr. Nasiha Soofie will be answering all of your questions on childhood vaccinations. Send those through to us on our Facebook page, Expresso Show SABC3. That's where you can find us on Facebook.
It's my Feel Good Breakfast Show.
Welcome back. This is your Feel Good Breakfast Show. It is a Wednesday morning, midway through the week and we are continuing our health topic chat this morning with our expert, Dr. Nasiha Soofie, who is the medical head for Sanofi Pasteur Vaccines, and is still with us, of course, answering all of your burning questions around childhood vaccinations. And we'd like to thank, of course, every one of you who sent through questions on social media. And if you have any other questions, please feel free to catch us on our social media platforms regarding these. Let's quickly tackle the first call. We've got Aniba, I believe, who is on the line. Good morning, Aniba.
Morning, Katlego.
Fantastic. Where are you calling us from, Aniba?
I'm calling from Fishhook.
From Fishhook. All right. Well, you're live on air and the doctor is listening in. What is your question?
My question is, I didn't vaccinate my child at the recommended time. So is it too late to catch up?
All right, doctor.
That's a very good question. So it's important to remember that the vaccination schedule which you receive when your child is born is not only a timetable. It's actually a scientific formula in that these timelines are carefully calculated as to when is the most appropriate time to administer a vaccine, such that when the vaccine is most needed by the child, as well as when the response to the vaccine will be most optimal. So we strongly recommend that you try as best as possible to adhere to the recommended times. However, some of your immunizations have been delayed. The worst decision to take would be to abstain from vaccination entirely. If you've missed a few vaccines, work very swiftly with your healthcare provider, depending on your special case, on what we call is a catch-up schedule. And the doctor will then work out a catch-up schedule for you based on which vaccines you have missed and when you need to come in order to attain them.
Fantastic. Aniba, thank you for the call, and thank you, doctor, as well.
Much for that.
Excellent. Have a good day.
You.
We have more questions, Doctor, from our social media platforms. This one comes from Melissa. She says, Dear Expresso, could you help find out if the usually scheduled government vaccination that would take place at schools for grade 4 girls will still go ahead this year?
So Melissa is likely referring to the HPV vaccine, which I know is an immunization program currently being carried out for female children at schools nationwide, and that is sponsored by our government. Currently, there is no guidance with regard to that immunization program.
All right. Another question that came through from Norma Parker saying, hi, I'm not sure if COPD, but I'm assuming that she was referring to COVID. So let's go with that. Saying that I'm a COVID patient and had injections for flu and pneumonia in November of 2019. Is it possible that these injections saved me when I had the coronavirus in June?
This is a good question. So this patient has what we call chronic obstructive pulmonary disease. Now, it's very important to note that vaccination is critical for everyone. Like I had mentioned earlier, it is a cradle to grave concept. These vaccines protect against some very severe, fatal, debilitating illnesses, such as meningococcal meningitis, influenza, as our correspondent had mentioned. And influenza kills 12,000 South Africans each and every year. So especially for individuals who have underlying medical conditions, such as COPD, asthma, even patients who have heart disease, diabetes, and so forth, these individuals are at an increased risk of acquiring an infectious pathogen, for instance, like influenza. And if they do get the infection, not only are they more susceptible to getting it, but they are going to get a severe form of the infection. Which is why it is absolutely critical that such patients, such COPD patients, as mentioned in this case, are totally up to date with all vaccines, and not only those protecting against influenza and specifically respiratory pathogens, but for all vaccines. Yes, to her point, it is absolutely critical that she is vaccinated, because not only is she at an increased risk of acquiring a vaccine-preventable disease, but she may likely be at an increased risk of acquiring coronavirus. So what she has done is she's protected herself against those illnesses for which we do have a vaccine, such that she is not further susceptible to a co-infection. In this patient, the worst case scenario is that she acquires a vaccine-preventable disease. Superimposed on that, she gets the coronavirus infection, and that would certainly spell disaster.
Yeah.
Such an insightful conversation,
Absolutely.
Doctor, and very important questions from our viewers as well.
Yeah, and my apologies to Norma for misreading your condition there as COPD. But thank you very much to Dr. Soofie for wonderful, wonderful insights, and for your time as well. We really do appreciate it.
Thank you for having me.
Well, there we go. Dr. Soofie joining us on the line there to give us her take on childhood vaccination and immunization, as today we look toward International Youth Day that we are commemorating and looking around all kinds of ways in which we can better equip ourselves with knowledge to protect ourselves from diseases in all kinds of ways. And hopefully you found that conversation insightful as well. But right now, time for some entertainment. Demone, what you got?